हॉट चीज़ें नहीं खानी चाहिए. उनके मदर इन लॉ ने बोला है गर्म चीज़ें खाओगे तो मिसकैरेज हो जाएगा.
Definitely, it is a myth.
आजकल सबको लगता है कि डाब का पानी अपनी वाइफ को पिला दिया तो तुमने बहुत अच्छा ध्यान रख लिया.
It is okay to have coconut water because it helps to keep ourselves hydrated.
Dates are very good for a normal delivery.
Dates are a very, very, very good, I must say, dry fruit.
जो फ्रूट्स में सीड्स हैं वो प्रेगनेंसी में नहीं खाने चाहिए, लाइक बैंगन, टमाटर. दिस इज आई थिंक अ मिथ.
This is a
गर्ल्स टेंड टू आस्क कि हम फर्स्ट ट्रिमेस्टर से सीड ले सकते हैं.
seeds, definitely.
प्रेगनेंसी में हम बोलते हैं प्रोटीन डाइट बहुत इंपॉर्टेंट है, और अगर आप अच्छा प्रोटीन खा रहे हो तो आपका बेबी का वेट भी बहुत अच्छा होगा. तो इन अ डे हाउ डू वी कैलकुलेट कितनी प्रोटीन देनी चाहिए?
Main nutrient throughout the pregnancy, very, very much required for the.
Diabetes के cases we are seeing a lot during pregnancy, which we call as gestational diabetes. So the moment they do have a very high GTT levels, we put them on a diabetic diet. So what exactly is the diabetic diet you would recommend for a patient who's first time detected to have a gestational diabetes in pregnancy?
Gestation diabetes, really, it is getting very common nowadays.
So today it's a great day. I'm sitting across with my friend, Dr. Deepika Kohli, a nutritionist, and I've known her for the last 1 decade. So Dr. Deepika, would you like to say something about yourself?
Thank you so much, ma'am. First of all, thank you so much for calling me for this session. Myself, Dr. Deepika Kohli, I'm a clinical nutritionist and working from last 25 years into this profession.
Thank you so much for being with me today here. So Dr. Deepika, I know you have a vast experience of dealing with pregnant women. And today all the new moms, they have a lot of questions as far as diet is concerned. And we really want them to gain about 10 to 12 kgs during the pregnancy. So I would like to take your advice and as how you tend to advise and make the girls follow your advice. So first of all, let's start with the first trimester. So when a new mom does come to us, we know that in the first trimester, a lot of nausea, vomiting, they have gastric pain, they're unable to eat enough. So we do give them medications, but they tend to ask us, how can diet help them? So I would like to ask you to let me know, what advice do you give them?
It's always better to have 5 to 6 meals rather than having 3 meals in a day. I want to say frequent small meals. 5 to 6 meals, and there should not be long gaps between the meals. They should have small meals, 5 to 6 frequent meals, and that too soft diet like khichdi, dalia they can include in their diet. Fruits like banana, apples they can add, and they should not stay empty stomach for a long time, because empty stomach will lead to bloating, gastritis, and which will lead to nausea and vomiting sometimes. And they can also use some home remedies like jeera water, soft water, which will ease their digestion.
So I also advise them that after meal, take a walk. So if they tend to walk around and not just sit down, then the digestion will also be much better.
Definitely.
And we also say sometimes ginger candies tend to help.
This definitely ginger candy helps. Ginger tea will also help them, and they can suck ginger juice also with lemon. With lemon, that will also help them.
And also one thing that as obstetricians we tell them, that the last meal in the night should at least be 2 to 3 hours before they go to sleep. And it should not be a very heavy meal, because otherwise in the night they have a lot of problem with sleeping at that particular time.
Very true, ma'am. Last meal should be 2 to 3 hours before sleep, and that too, it should be a very light meal, like a light leafy vegetable or seasonal vegetable like torai, tinda, lauki, with 2 chapatis and a bowl of curd. Curd should also have some black pepper and bhuna jeera in it, so that it will ease the digestion.
Another thing that I have really noticed कि फर्स्ट ट्रिमेस्टर में लड़कियां बोलती हैं हमसे दूध नहीं पिया जाता. थोड़ा सा भी दे ड्रिंक मिल्क, दे फील लाइक वॉमिटिंग और दे फील वेरी फुल. सो हम क्या ऑल्टरनेट दे सकते हैं उनको मिल्क के लिए, या हाउ कैन वी एडवाइज देम टू टेक मिल्क ड्यूरिंग द फर्स्ट ट्रिमेस्टर?
We can milk is quite required during pregnancy because of the good calcium in it and good quality of protein in it. But definitely they complain, pregnant women complain of like they are not able to digest milk and they are not liking the taste sometimes. So I advise them to take it in some other form. Like nowadays in the summer season, they can have some shakes like banana shake, mango shake, or almond milkshake, or in the form of buttermilk. If they are not able to digest the shakes also, they can switch to curd. The buttermilk they can have charge, or in the form of paneer also they can have.
They can do that, yes. So अगर हम एक ग्लास मिल्क बोलें तो उसमें कितना पनीर will be a substitute for 1 glass of milk? 100 grams or?
100 grams.
So one milk would be equivalent to
100 grams. They need to have 100 grams of protein.
The third thing that I face is that they tell us that हॉट चीज़ें नहीं खानी चाहिए. उनके मदर इन लॉ ने बोला है गर्म चीज़ें खाओगे तो मिसकैरेज हो जाएगा. तो ऐसी कौन सी, इज इट अ मिथ फर्स्ट थिंग, एंड सेकेंडली व्हाट आर द थिंग्स दैट दे शुड अवॉइड ड्यूरिंग द फर्स्ट ट्रिमेस्टर ऑफ प्रेगनेंसी?
Definitely, it is a myth. Like they want to suppose have almonds in summers and during pregnancy, they can go for soaked almonds. They can go for soaked walnuts, which will definitely help them. But I must say, moderation is the key. They can have all these things, but in moderate amounts.
And what about eggs during pregnancy?
Egg has the best protein. Best biological value protein egg has. So definitely if she is willing to have eggs, then she should have eggs. One whole egg definitely she can have as a evening snack or in the breakfast, or egg white salad during dinner time also she can have. It is easily digestible. Egg white protein is easily digestible. But at the same time, like I said earlier also, in moderate amounts. She can't have if she wants to have 3 whole eggs omelette, definitely it can harm. But one whole egg or 2 whites omelette is definitely fine.
And चाहे egg लें या चाहे omelette लें या they want to make any other form, any form is all right.
Any form is all right.
1 or maximum 2 eggs.
2 eggs.
And it should never be raw. It should always be
yes,
well cooked.
It should well cooked.
And summer में ऐसा नहीं होता कि egg नहीं ले सकते.
ले सकते हैं.
आराम से I think summers में also they can
ले
be
सकते
having
हैं. बिल्कुल ले
eggs.
सकते हैं. हाँ जी.
The fourth problem that they feel is constipation.
Yeah.
जैसे pregnancy start होती है, they start saying we have constipation.
Yes, ma'am.
So I feel they're not having enough fluids. क्योंकि diet अच्छी नहीं है तो fiber ज़्यादा नहीं खा रहे हैं वो लोग. Fruits intake थोड़ा सा कम है. Maybe that is leading to it. So आपकी क्या advice है कि क्या चीज़ें specifically will help them relieve constipation?
Yes, ma'am. Fiber is the traffic controller of all the diseases. So fiber is the main important, and which is always we don't think about it, because nowadays new pregnant women definitely their lifestyles are like they are having too much of simple sugars like refined flour based things. Because of that they suffer from constipation because it is fiberless. Rather than having simple carbs, they should focus on complex carbohydrate. Complex carbohydrate are whole grains like dalia hai, and whole wheat with good amount of bran in it, oats with good amount of oat bran in it, which this all will help to ease their constipation. And fruits, fresh vegetables, seasonal vegetables. ऐसा नहीं है कि पालक नहीं आ रही है सीजन में and they are having palak in it. So every time in every season they should focus on seasonal vegetables, seasonal fruits they should have, and focus on whole grains rather than having refined flours, which will definitely ease the constipation.
So talking to this, another question came to my mind, and that's the coconut water. आजकल सबको लगता है कि डाब का पानी अपनी वाइफ को पिला दिया तो तुमने बहुत अच्छा ध्यान रख लिया. सो वुड यू से इट इज़ अ होल फूड, एवरी प्रेग्नेंट वुमन शुड हैव इट डेली, और इज इट जस्ट ओके टू हैव अ कोकोनट वाटर?
It is okay to have coconut water because it helps to keep ourselves hydrated, And hydration is very important in every season, but in pregnancy person should be fully hydrated. But a glass of coconut water, instead of coconut water, they can have lemon water as well, they can have charge as well, they can have some vegetable juice also. It will do the same.
Same. Yeah, so that's why I keep telling all the husbands, essential नहीं है कि तुम हर रोज कोकोनट वाटर खरीद के लाओ और दो. अनदर थिंग आई हैव सीन कि सबसे पहले एम्प्टी स्टमक में वो फुल ग्लास कोकोनट वाटर दे देते हैं और उसके बाद जो इनको वॉमिटिंग होती है, फुलनेस होती है. सो समवेयर आई फील अर्ली मॉर्निंग कोकोनट वाटर का क्या ट्रेंड है? इज इट अ मिथ दैट यू शुड गिव इट एम्प्टी स्टमक?
Yes, ma'am, it is a myth. It is a myth. Rather, they can have coconut water. The best time to have coconut water is mid-morning, like between breakfast and lunch, 11:30, 12ish they can have.
I think that's a very good point you've highlighted because I've seen invariably empty stomach में first thing coconut water पीते हैं, उसके बाद breakfast खाया नहीं जाता है and then they land up with lot of vomiting. So now let's talk about some other myths that are there. So first myth, dates are very good for a normal delivery. एंड वो हमसे सेकेंड ट्रिमेस्टर 20 वीक से पूछने लगते हैं, मैडम 2 डेट्स ले लें, 3 डेट्स ले लें, कितने डेट्स लेने हैं? सो डू यू थिंक दैट डेट्स इज़ वेरी एसेंशियल लेबर में जाने के लिए या नॉर्मल डिलीवरी के लिए, या उसकी वैसी ही वैल्यू इज़ गुड इनफ?
Dates are a very good, I must say, dry fruit. One should have, but again the same thing in moderation. But it is a myth, like it will give you uterine contractions. ऐसा नहीं है. It is a myth definitely. But in the last trimester, they can have 2 to 4 dates per day, or dates laddu also they can have.
अच्छा, दैट मीन्स हम बोले 7th मंथ में जब वो एंटर करते
Yeah,
हैं, देन इससे हीमोग्लोबिन भी थोड़ा अच्छा हो जाता
hemoglobin
है,
भी
because
बढ़ेगा.
dates tend to
हाँ,
rise,
फाइबर
right?
कंटेंट बहुत अच्छा
फाइबर
है.
अच्छा.
हाँ.
सो दैट विल बी बेटर टाइम कि 28 वीक से वो स्टार्ट कर लें, 3 to 4 dates.
Dates shake, dates laddu are very good.
Good.
Very good. हाँ.
अदर मिथ दैट दे हैव कि जो फ्रूट्स में सीड्स हैं वो प्रेगनेंसी में नहीं खाने चाहिए, लाइक बैंगन, टमाटर, एंड समटाइम्स ऐसे टिंडे में भी सीड्स हैं, हमें टिंडे नहीं खाने चाहिए. सो दिस इज आई थिंक अ मिथ. आपका क्या इसमें है?
This is a myth. It is not at all scientifically proven. No, ma'am. हाँ.
मे बी सीड्स में थोड़े शायद कीड़े होंगे, सो दे शुड जस्ट चेक इट आउट,
Just
soak
check
it
it
well.
out, हाँ.
बट ऐसा नहीं है कि सीड्स प्रेग्नेंट सीडेड फ्रूट्स या
ऐसा नहीं है.
वेजिटेबल्स
हाँ.
नहीं ले
They
सकते.
should soak it well and cook it well.
Well, cook
हाँ,
it
cook it well.
So I think that is another myth that we have busted, that seeds containing vegetables and fruits can easily be taken in.
Easily be
taken
taken.
in
Easily be taken.
pregnancy.
हाँ. Well cooked. हाँ.
Yes.
And chew it properly. Every food, because if you want to get good fiber from the food, we need to chew it well.
Okay. The third thing that I feel it's a myth, जब भी मदर इन लॉ साथ में आती है और वुमेन हमारे 8th या 9th मंथ में जाती है, वो सबसे पूछे, मैडम अब घी डालना शुरू कर दें? तो मैंने कहा घी तो डालते ही होगे. बोले नहीं, अब दूध में 2 चम्मच डाल दें, दाल में 2 चम्मच डाल दें, डिलीवरी बहुत अच्छी हो जाएगी. तो व्हाट डू यू से अबाउट दैट?
Again the same thing. It is ghee is full of nutrition, good nutrient content, vitamin A, good amount of calories which are required in the last trimester. But this is a myth कि it will ease the labor. Definitely it will give a very good immunity. It will definitely give good amount of nutrients. But this is a myth कि it will induce labor.
So in a day, अगर you would say desi ghee would be a better ghee to take?
Yeah, desi ghee, cow ghee is very good. Very
And
good.
कितने चम्मच अगर हम बोले per that lady can take 2
2 to 3 teaspoons per person per day. हाँ.
And this can be taken all throughout the
All
pregnancy?
throughout the pregnancy. I advise all throughout the pregnancy, and 2 to 4 also it's good.
It's
2 to
good.
4
They can take
teaspoon.
that.
Yeah.
And you said
But-
cow ka desi ghee would be a
हाँ.
better one.
And one more thing I want to add into this, like if you are having ghee, if you want proper nutrition from that 1 teaspoon of ghee, you should have it raw. Do not fry your parathas or your dosa or your chilas in ghee, because you'll get the flavor out of it, but you will lose the nutrients of the ghee.
So when you mean by raw, how
Like in a bowl of dal, you can add ghee, or your paratha, you
On
can
the top you
on
can
the top
apply
you can apply the ghee, or on the chilas, in rice you can
So
add
that
ghee.
would be a
That is
better
very
way-
better way to
take.
consume ghee.
Okay. So now the fad, or I will not say fad, reality about the mixed seeds that they are there. Aajkal a lot of chia seeds, pumpkin seeds, and there's so many seeds. So girls tend to ask कि हम first trimester से seed ले सकते हैं? कौन सी seed अच्छी है? हमें भिगो के लेना है? कितने क्वांटिटी में लेना है? तो आप इस पे ज़रा हमें हाईलाइट दीजिएगा.
सीड्स डेफिनेटली बहुत अच्छे हैं, न्यूट्रिएंट डेंस हैं, प्लांट प्रोटीन है सबसे अच्छा, और बट in moderation. Like 1 to 2 teaspoon of mixed seeds is more than sufficient throughout the pregnancy. Daily 1 to 2 teaspoon seeds, mixed seeds. And when we talk about chia seeds, it is definitely need to be soaked, because people do not know, they just seeds खाना है और seeds खाना शुरू कर दिया. They have digestive issues if they just gulp 1 teaspoon of chia seeds, because they need to soaked for 3 to 4 hours before consuming.
I think that's a very valid point that you have raised onto that. Okay, now let's come to very basics of nutrition. Pregnancy में हम बोलते हैं प्रोटीन डाइट बहुत इंपॉर्टेंट है, और अगर आप अच्छा प्रोटीन खा रहे हो तो आपका बेबी का वेट भी बहुत अच्छा होगा. तो इन अ डे हाउ डू वी कैलकुलेट कितनी प्रोटीन देनी चाहिए?
जी मैम, प्रोटीन द मेन न्यूट्रिएंट थ्रू आउट द प्रेगनेंसी, very much required for the fetal growth, amniotic fluid. It is definitely very much required protein. So 50 to 70 grams of protein is required daily, and the requirement increases when the pregnancy progresses. Like first trimester, they require 1 to 1.2 grams of protein. Gradually it increases, protein requirement decreases. So protein, I just want to share a sample plan with you with a high protein diet. So a pregnant woman should start a day with a glass of water. If she wants to add lemon, this is optional. Like if she's in a habit, I have seen many girls in a habit of having lemon water in the day. But I advise them not to have hot water. We are not going for weight loss. Because lemon water, empty stomach, definitely in initial first trimester, if they are facing nausea problem, vomiting problem, so that will ease. That is why I advise them to have a glass of water, lemon water. Otherwise, they can just start their day with a glass of water. Then if they want to have coconut water or milk, it's optional. Then with that, they can start their day with 1 teaspoon of mixed seeds and 4 to 6 soaked almonds, which will give them 5 to 6 gram of protein to start the day. Then for their breakfast, like if they are having 2 moong dal chila with green chutney and paneer stuffed in it, it will give them 12 to 14-15 grams of protein. To besan chilas or moong dal chila or besan chila. Then in between, they can have a fruit or a glass of chach, which will also give them 5 to 6 grams of proteins. Then a good lunch, high protein lunch. For high protein lunch, they can go for 2 multigrain chapatis. See, multigrain, when we talk about multigrain, so people do not know what millets should we include according to the season. बस they just think कि millets खाने हैं, high protein खाना है, तो कुछ भी डालेंगे उसमें आटे में. Like in summer season, they are adding makka, they are adding bajra, वो सब which is very heavy और गरम भी है. तो season के हिसाब से, like nowadays we can have jaw, jowar, chana, ragi. These things can be added, and that will give you a multigrain chapati. With that, we can have dal, rajma, chole, chane, lobia, all high protein, good lentils, with a bowl of salad and a bowl of raita. This will give you 15 to 17 grams of protein for lunch. Then for evening snack, if you are having a glass of milk or a shake or tea, coffee, with that they can have roasted chana or a bowl of makhane or a handful of peanuts or just peanut salad with some sauté veggies. This is also very good protein source. Very good. And people relish it also. peanut salad or paneer peanut salad. This will also give 7 to 8 grams of protein.
Okay.
Because the portion should be less during the evening snack. Because if you have a very heavy portion during evening snack, you will not be able to have your dinner.
Yeah.
And if the dinner is late, again the morning nausea and problem like bloating and gastritis will be there. Then for the dinner also, a millet chapati or a multigrain chapati, not a single millet chapati. Wheat is also required. It is not that only millet you are having, only chana chapati or only jaw chapati. Mixed multigrain chapati with a seasonal vegetable like lauki, tori, dahi, like this we can have, or a paneer bhurji, tofu bhurji, or egg bhurji. This will also give you 12 to 15 grams of protein.
Proteins. So that's a very well defined during the day. And milk, 1 glass of milk should be enough during the day.
One
अगर ये सब खा रहे हैं
जी
सब, तो
जी
इसके
बिल्कुल
साथ 1
हाँ
glass.
1 glass of milk is absolutely fine because they are having curd also, raita also, paneer also, so protein is taken care of.
care of onto that particular one. And अगर ये नॉन वेजिटेरियन है तो इसमें चिकन ऐड कर देंगे.
बिल्कुल हाँ.
And what other non-veg foods would be good in proteins that they can?
Chicken has very good protein. It's called complete protein. Egg is a complete protein. Egg is the best biological value protein. So egg bhurji for dinner, or if very fond of chicken, then for dinners I would suggest to have chicken breast salad. And chicken should not exceed more than 250 grams. Rather, we'll have more of veggies, like chicken breast salad with good amount of veggies. So it is a good combination of protein as well as fiber, because veggies are giving us fiber, chicken is giving us protein. So it is a good blend. Or a 2 whole eggs omelette with lots and lots of veggies in it.
So a little question, a little different, because I don't eat fish, so I'm not able to answer the questions about fish. So एक चीज़ जो पूछते हैं ये लोग कि आप fish good, कौन सी fish खानी चाहिए और कितनी fish लेनी चाहिए. So would you be able to highlight that?
Yeah, yes. Salmon is very good. Salmon is very good. 100 grams of fish is more than enough.
Okay.
100 grams of fish. Like can have fish tikka, can again have fish curry with rice. They can add. And I want to add one more thing about rice. Like nowadays, we see young girls before getting conceived, they were on some weight loss journey. I see like patients like this. So they say कि rice, they have strained rice, कि too much weight gain हो जाएगा हमारा. तो I teach them, I tell them कि please do not think about, right now this is not the time to think about weight loss or too much weight gain, because the strained rice, definitely it loses some of carbs, but not all the carbs. This is a myth कि if we are straining the rice, we are losing all the carbs. We are not.
Okay.
But at the same time, when we are straining the rice, we are also losing B complex vitamins. So if you want, you can have small portion of rice, but do not strain it. Like chicken curry with rice, a very good protein and carb combination.
Together, that can be done onto that once there. Okay, so now let us move on to yet another problem that women has, anemia. So they start pregnancy with a low hemoglobin. फिर हम हमेशा देखते हैं कि third trimester में आके फिर और hemoglobin कम हो जाता है. So what are the iron-rich diet that you would recommend for them to add कि हमारा iron थोड़ा increase हो जाए, और क्या चीज़ नहीं खानी चाहिए कि iron की absorption कम हो जाए?
Yes, ma'am. Iron definitely very much required throughout the pregnancy. So iron-rich foods like leafy vegetable, roasted chana, a piece of jaggery. Roasted chana with a piece of jaggery helps a lot in iron absorption. But we take too much good care of iron throughout the pregnancy. But we do not think about vitamin C. Iron absorption is only in the presence of vitamin C. So whenever we are having a good leafy vegetables or a dal or beetroot or eggs, whatever, all iron rich foods, we are taking good care, and we are daily in the breakfast, lunch, dinner, we are taking care of iron, protein, everything. but we forget about vitamin C. So विटामिन ई की प्रेजेंस में बहुत अच्छा एब्जॉर्प्शन होता है आयरन का. सो एब्जॉर्प्शन शुड बी टेकन केयर मोर ऑफ. सो हाउ वी कैन ऐड, लाइक we are having roasted chana, or a black chana chaat we are having, or a chickpea salad we are having. So please add a lemon, squeeze a lemon over it, which will enhance the iron absorption. Or a vegetable juice if you are having, or a pomegranate juice, a glass of pomegranate juice, squeeze a lemon over it. Increase the amount of amla in the diet. Amla, fresh amla juice can also be had. So this will all enhance the iron absorption. Like beetroot tikki is very good for iron. So how to make beetroot tikki? In the beetroot you can add some crushed peanuts also. Crushed peanuts and some paneer also. So it is a high protein, high iron with a half bowl of green chutney, dhania pudina chutney, which has vitamin C also, which has green chilies. Green chilies have vitamin C more than lemon.
Okay,
So green chilies are very good. It's better to avoid red chilies throughout the pregnancy and switch to green chilies. Very good fiber, very good amount of vitamin C, and which will definitely enhance iron. And what not to have? Tea definitely inhibits iron absorption, because tannins in tea inhibits iron absorption. So if you are very fond of tea, so just have 1 or 1.5 cup of tea throughout the day, and that too, do not have it with the meals. Like you had stuffed paratha with leafy vegetable like palak paratha. It is a very good for iron.
Yeah.
But along with that, you are having a cup of tea. So you are all killing the iron
absorption. Yes.
Killing the iron absorption also, killing all the nutrient also. So if you want to have tea, have it after half an hour. Do not have it with the meals.
So like it is summer, आप ग्रीन लीफी वेजिटेबल्स की बात करते हैं. इसमें ना पालक आ रहा, ना साग आ रहा, ये नहीं आ रहा. तो समर में कौन सी ग्रीन लीफी वेजिटेबल्स हम बोल सकते हैं जिसमें आयरन कंटेंट अच्छा?
समर में हम धनिया पुदीना चटनी, इट इज़ वेरी गुड. It has vitamin A also, very good fiber also. So daily they can have dhania pudina chutney. They can have sattu shake. Sattu shake is very good.
और protein भी है, उसमें
iron भी है. Sattu stuffed paratha they can have. It is very good. Or if they are non-vegetarian, then they can have lemon chicken curry with rice. They will definitely have organ meats. They have very good iron.
So now when we're talking about tea, so I'm just asking the next question, because girls are very fond. ऑफिस में काम कर रही हैं, कॉफ़ी पी रही हैं, चाय पी रही हैं. तो प्रेगनेंसी में आप कितना चाय इन अ डे वुड यू रेकमेंड?
1 to 2 cups.
Not more than that.
Not more than that.
The next question that they ask, ग्रीन टी ले सकते हैं? अगर आप चाय मना करो तो हम ग्रीन टी ले लेते हैं.
It is the same thing.
It's not a difference.
It's not a different.
So whether you take green tea or you take tea, so I normally recommend 1 cup tea and coffee, and not more than 1 cup. 1 cup बोलेंगे तो शायद maximum वो 2 पे रुक जाए.
Lemon tea will help.
Lemon tea will help
because of the lemon, and that too it should be fresh, not that tea bag.
Yeah, so green tea also is those tea bags that they're putting, but अगर वो flakes लाके डाल लें green tea या lemon tea, that would be definitely
that
right.
is.
And as far as coffee is concerned, what we tend to say is that 1 cup of coffee, which is moderate amount. So not a very strong coffee, that's not recommended, but 1 cup coffee they can take during the day. So the next, I think anemia we have dealt with very good, because iron-rich diet is very important, and all throughout pregnancy चलनी चाहिए pregnancy. अब हम another thing जो हम pregnancy में बहुत देख रहे हैं, and we know India is a capital of diabetes now, and in pregnancy is like a mirror. जो लाइफ में बाद में होना है वो प्रेगनेंसी में एविडेंट हो जाता है. इस चक्कर में हमने डायबिटीज़ के केसेस वी आर सीइंग अ लॉट ड्यूरिंग प्रेगनेंसी, विच वी कॉल एज जेस्टेशनल डायबिटीज़. सो द मोमेंट दे डू हैव अ वेरी हाई GTT levels, we put them on a diabetic diet. So what exactly is the diabetic diet you would recommend for a patient who's first time detected to have a gestational diabetes in pregnancy?
Yes, ma'am. Gestation diabetes, really, it is getting very common nowadays. So we can't put the pregnant woman on a very strict diabetic diet as we give a normal diabetic patient, because we have to take care of all the nutrients. So it is somewhat tricky, because we have to take care of all the nutrients throughout the day. Along with that, we have to also take care of their high blood sugar levels. So I would suggest them simply, first of all, they have to avoid outside food. Junk food they have to simply avoid, because they are having very good diet at home, breakfast very good, lunch very good, dinner very good, but in between the meals or from the outside they are having simple carbs. Outside it's all simple carbs, processed food, because that maida, that refined flour, will increase their blood sugar levels. So they have to first of all avoid that. And whenever they are the chapati, the wheat, we need to give them wheat, but it should be whole wheat and supported with some brands like wheat bran or oat bran, because these are complex carbohydrates.
Yeah, absorption is much
Absorption
less,
is much
sugar
easier,
intake.
and when we are giving it with the fiber, it's all fiber, तो sugar spike भी कम होगा, है ना. तो साथ में we can support with more of veggies, and I tell them to have chapati once a day, like for lunch. That too multigrain chapati with good amount of bran in it, like 1:1:1. One ratio will be whole wheat, one will be chana, and one will be oat bran. So this chapati is good enough to control their blood sugar levels. For the breakfast, they have to have vegetable oats. They can have besan chila, moong dal chila, or a sattu shake in between, so that it will keep them full also. And for lunch, they can have multigrain chapati. Evening snack, they can have roasted chana, makhane. And dinner, they can have vegetable jawar dalia. They can have vegetable oats dalia rather than having wheat dalia. Because wheat has high glycemic index. So we have to include things, foods and vegetables which have low carbohydrates. Complex, more of complex. Or they can have chila with grated lauki in it, which will filling also, good fiber also, and with green chutney, and we can add some paneer also, or with that we can have paneer vegetable with that. So this is all. This will definitely take care. Wheat once in a day, rice we can avoid for some time till the blood sugar levels come down. Or and too, if they are rice eater, it's their staple food. For lunch they can have small portion, very small portion, but it should be supported with a good amount of dal, good amount of vegetable, salad, vegetable raita. It is more preferred, because it will give them a feeling of fullness, like lauki raita, kheera raita, onion tomato raita. They can have, but this will definitely, all which I have just shared, the plan, it will only help them if they are not having maida. If with this they are having some cookies, some namkeen, some refined flour things,
Then it all gets balanced.
Ah.
So what about potatoes? I feel potato is another thing that needs to be avoided because it tends to lead sugar levels high. Would you say that?
Not too much. It is a myth again. Potato chips, potato tikki definitely will increase. But potato in some vegetable, like we are making methi aloo, or we are making gobi aloo vegetable. In some vegetable, we can have that much potato we can have. And potato, when it cools down, it resistant starch is developed in it, which is definitely helps in controlling blood sugar. It has very good potassium also. Potato is a very, very good vegetable. Very good vegetable. But the thing is how we are having it. Chips are definitely no. Chips are definitely no.
So means in vegetables, cooked the potatoes are
Cooked
good.
potatoes are okay. Stuffed aloo paratha is also
Also very
okay.
good.
But because you add a small amount of potato, add good amount of onion, ginger, coriander leaves with green chutney, it helps.
Etc. So now what about the fruits which tend to lead to high sugars? So what about mango? We say grapes, chiku, or watermelon. So are they supposed to increase the sugar? Should they be avoided?
Yeah. These
Just-
all fruits are on high glycemic index. Watermelon has high glycemic load, so this should be avoided. Instead, they can have an apple और
नाशपाती
पेयर,
हो गई।
हाँ, अनार, ये सब खा सकते हैं। हाँ,
और अनार भी आराम से ले सकते हैं।
अनार भी खा सकते हैं, गुड फाइबर कंटेंट।
What about खरबूजा? Is खरबूजा also?
That will also increase a small portion they can have.
There.
हाँ.
So everything is in moderation.
Moderation. हाँ.
So normally for a pregnancy, I tell them take a bowl of fruit with all colors.
All colors, yeah.
So that would be a good one. तो सब कुछ थोड़ा थोड़ा आ जाएगा.
थोड़ा थोड़ा आ
and
जाएगा.
it will be a variety in
हाँ.
which they can have it
Yes,
all
ma'am.
during in the pregnancy. So now moving to a little postnatal period that we are talking about. So एक बार baby आ गया घर में, everyone is very happy. Now mother has to lactate, so there has to be enough milk production. So one concept जो सब ladies बोलती हैं कि दूध खूब पियो, milk उतना बढ़ेगा. So हमारा concept ये होता है दूध is good for hydration, good for proteins, good for calcium that she needs because she's feeding. But ये नहीं कि जितना milk पियोगे उतना दूध बढ़ेगा because milk cannot come out in the breast. So how much milk would you recommend? Maybe 2 glasses?
2 glasses. 2 glasses is more than enough. हाँ.
And what are the other things they should add in the diet so that milk production is better?
Yes, they can have like some home remedies like jeera water, ajwain water, saunf water. This really helps. Bhuna jeera definitely helps. Like they can have sprinkle some bhuna jeera over their raita, over the chach. They can definitely have milk dalia, vegetable dalia. It also helps in milk production. But in moderation, everything in moderation. Like if we are preparing vegetable dalia, because I have seen lactating mothers also suffering from constipation. So vegetable dalia should have good moong dhuli dal, vegetables, and along with the dalia. This way it should be cooked. And in between the meals, papaya is very good. Because for constipation also and vitamin A also. Soups are very good in between the meals. As an evening snack, they can have a good bowl of soup. They can have. And in that soup also, they can sprinkle bhuna jeera, which will help.
And ये जो हम बोलते हैं कि राजमा और चना मत खाओ during the lactation means heavy things which can cause a lot of gas. So is it a reality or they can have it, or what will it say?
Definitely they can have. It is a myth. It has no scientific reason that they should avoid, but it depends upon the individual at the same time. Okay. Like if you should find out the trigger foods. Find out the trigger foods, like if you had rajma and after having rajma or after having chole, you had acidity, you had bloating, then you should avoid. Otherwise, there is no scientific reason behind it. They can have in moderation. Lunchtime they can have.
और ये जो गोंद के लड्डू खिलाते हैं, इसका क्या reason है?
It is a nutrition dense. Gond is definitely nutrient dense. It gives you good amount of iron, fiber. It's very good. But again, we should not only make it a gond ka laddu. We should add something else also, like methi gond laddu or dates gond laddu. These are very good options.
And they should also be taking maybe in moderation 1 or 2.
1 or 2, like with a glass of milk they can have in the morning and as an evening snack in the evening. Not more than 2.
एंड एक ये जो कंसेप्ट है कि अब बेबी हो गया, अब तो हम बहुत सारा देसी घी दे सकते हैं इनको. सो फॉरेन कंट्रीज़ में इफ़ यू सी दैट विमेन, ये कोई देसी घी बगैर ज़्यादा तो चलता नहीं है, बट इंडिया में वी हैव अ स्ट्रॉन्ग कंसेप्ट. यू टोल्ड इन प्रेगनेंसी ऑल्सो 1 to 2 tablespoons is good. So even in the postnatal, should it be the same amount?
It should be the same amount. Same amount.
It's not that they need to put on extra.
Too much, no.
Because the fat they tend to put on, after all, that lady only has to work and remove that fat. It's not that it will be very beneficial, but 1 or 2 tablespoons in the day would be good enough.
Good enough. Yeah, good enough.
Yeah. So, would you like to add anything else from your side? What you would recommend in pregnancy, lactation?
They should have a balanced diet. Balanced diet means a good combination of protein. Proteins should be taken throughout the day. Like ऐसा नहीं कि सिर्फ breakfast में ले लिया. Throughout the day, like besan chila, with paneer in it, and as I told earlier, lunch with dal, rice, roti, so good amount of protein and cereals. So throughout the day we should distribute the protein, and fiber should be taken a very good care of, which we can get from the vegetable and fruits and whole grains. And whether we are pregnant or mother is lactating, we should strictly avoid processed food and packaged food, refined flour based preparations, because these things have no nutrition. Rather, they are not letting good nutrients to be absorbed.
Yes. And another thing we do tell them, we have always seen that pregnant women are very prone to have infections. So invariably जब वो डायरिया करके आती हैं हमारे पास, when we tend to ask आपने क्या खाया, so it has been that they have consumed something from outside. So street foods like गोलगप्पे, टिक्की आप बाहर सड़क पे खा रहे हो, आपकी immunity वैसे ही बहुत low है, and then you tend to take these things, you're very prone to develop diarrhea and infections. So you can have them, but have it from a place where you're assured that there's quality, there's hygiene, and of course, as you have already said, always in moderation. So every diet should have a good amount of protein, good amount of carbohydrate. It should also provide you fat, because all are required for the growth of the baby and for the good outcome for the mother. But yes, what I would recommend is that in every trimester, it's very important for a pregnant woman to meet a nutritionist, to be able to really get your diet, to get all your misconceptions cleared, and to be able to put on the right amount of weight and have the right amount of energy to be able to take care of the baby after that. So thank you so much,
Thank
Dr.
you, ma'am.
Deepika.
Thank you so
I
much,
think
ma'am.
I have learned a lot from you today.
Thank you, ma'am.
And
Thank you,
together
ma'am.
we can definitely take care of all
It's
of
my
it.
pleasure, ma'am. I'm being with you.